Hi everyone, it's Dr. Peter Hartman with another video on a mental health topic. Today the topic is loneliness. Now loneliness is not a mental disorder. However, it's been shown to adversely affect our physical, cognitive, and mental health. So it is important to mental health professionals, but it's very distressing to many people. So what is it? It's not merely being alone or by yourself. I mean, you can be lonely in a room full of people. It's a very distressing mental state in which you perceive yourself to be disconnected from other people, and that leads to feeling sad and/or anxious. Now, most of the content from today's video comes from an excellent research paper on loneliness from the Journal of Clinical Psychiatry at the end of last year by Nguyen and colleagues. So what are some of the predictors or potential causes of feeling lonely? Social anxiety is the #1 cause. If you're very socially anxious, you're likely to have the worst form of loneliness. This means that you feel anxious in social situations, primarily when you don't know very many people, going to a party where you don't know other people who are there, going into a classroom with students that you haven't met before, having to get up in front of that class and give a presentation on some topic you were asked to prepare for. And it turns out it is the strongest predictor of a high degree of loneliness. Now, at its most extreme, which is to say that it's very distressing and/or it interferes with your normal functioning, then it rises to the level of a social anxiety disorder, and that is a mental disorder. And it benefits greatly from therapy, with or without medications that your doctor can provide. Another predictor is lacking a social support network. Basically, that means having regular, meaningful interactions with people who you can confide in, they can confide in you, you can share your concerns. Essentially, you can be yourself and feel accepted for who you are. And it turns out that it's the quality of the interactions that matters most, not the quantity. So it's far better to have 1 or 2 close friends that you're comfortable with, that you can share your true self with, rather than a large number of acquaintances. Now, the researchers also found out that anxiety is a predictor of loneliness. That is to say, people who are anxious are more likely to experience loneliness. So it goes in 2 directions. If you're anxious, you're more likely to become lonely, and if you're lonely, you may experience anxiety as a result of that. Now, it surprised the research to be lonely. Another predictor or possible cause is having a low sense of self-efficacy. That is to say, do you have the thought and belief that what you do can make things happen, that you can reach your goals, you can be successful? Or on the other hand, if you're low in self-efficacy, you might feel as though you're just being pushed around by fate. You have no real control over your life. So if you have low self-efficacy, it turns out you have a much higher risk of loneliness. Having a low pro-social behavior, that's a technical terminology that the social psychologists use, essentially it represents a desire to help others, either individual people or the world as a whole. And when you're someone who is generous, you're willing to volunteer, act as a good citizen, you have high pro-social behavior, and you're far less likely to be lonely. And when you do volunteer work, like at a food pantry or what have you, this is a reflection of compassion. And compassion, it turns out, is a reflection of wisdom and also pro-social behavior. So volunteer work can be a great thing to do to reduce your risk of loneliness, or if you are lonely, volunteering may help to eliminate it or at least reduce it. Now, the researchers were also surprised at a finding that people in their 20s and people in their mid-40s have the highest incidence of loneliness. In contrast, people in their 60s have the lowest incidence of loneliness. Now, what do you do Well, wisdom helps. I already mentioned that. Having lots of friends obviously matters. So having meaningful relationships is very important, so you should focus on that. If you're struggling with loneliness, develop meaningful relationships. Take responsibility for having friends. Invite them. Don't always wait for someone to invite you. Suggest things to do. Offer help when it's needed. This is a great example of compassion as well. And choose people who are supportive and accepting of you, who share common interests. You're more likely then to have a good, solid relationship. And you need to go where compatible people are. So if you are a religious person who goes to church, well, then try to find people at church. If you like to exercise, you may meet people at your gym. If you like to read, maybe a book club, that sort of thing. But follow your interests and try to find people who share those interests. Compassion we've already talked about, and that means to engage in socially rewarding experiences, and volunteering is one of the most important ones. You can volunteer at your hospital or a food pantry, your church. You can join a group engaged in meaningful activity, like a gardening club. So it's not just any group activity, it has to be meaningful to you. Work on your self-efficacy. Remember, people that don't feel that they have much control over their lives are low in self-efficacy and far more likely to become lonely. They just feel like they don't have control over any part of their life. So examine your beliefs about your capabilities. Beliefs matter. Do you put yourself down? Do you say to yourself, oh, you can't do that, you'll never succeed? If so, you need to change those beliefs. And it may require either a counselor or a coach to overcome those. But you may be able to do it on your own. Having a role model helps. Find people in your life who are quite successful and feel self-confident and have high self-efficacy. They feel like they can make a difference, and model yourself after them. Now, this is one thing that can help. It's not in the research paper, but it is well known that pets can reduce loneliness. If you like pets, and if you're not allergic to them, of course. And petting a pet actually reduces your blood pressure and can be helpful both physically and mentally. So the bottom line is that loneliness worsens your physical, cognitive, and mental health. It feels bad, and therefore you need to do something about it. Meaningful relationships of high quality, not just quantity, makes a huge difference, and you need to be proactive in reaching out and creating these relationships. Engage in social activities that you like. Find other people who share those things that you like. Do volunteer work. Compassion is powerful. And finally, take responsibility for your social life. You should reach out. You should take positive measures. That's where your self-efficacy comes into play. Well, hopefully you found this discussion on loneliness to be helpful. If so, please hit the like button. And if you have any suggestions for other topics, please leave those in the comment section. Thank you, and have a healthy day.